How do we improve mental health nurse retention? Nursing in the UK is facing a critical workforce crisis. The People Plan to address this crisis is based on limited evidence, and there is variation in how it is implemented across NHS trusts. How do trusts retain nurses and protect their well-being? Researchers from the University of Sheffield carried out a mixed method study to explore mental health nurse retention. This included a survey of 392 mental health nurses across 3 trusts to understand the scope of the issue, and interviews with 30 nurses and 10 senior leaders to identify key factors informing nurses' intention to leave. The key findings of the research was that most nurses were considering leaving their job or nursing altogether. Over 2/3 of those surveyed were considering leaving their job. Almost half were considering leaving their organisation, and 1/3 were considering leaving nursing altogether. 5 key themes played into mental health nurses' decisions to leave: the support of leadership and management, opportunities for training and development, the work environment for mental health nurses, which influenced disillusionment with mental health nursing, and caused staffing pressures. Staffing pressures exacerbate the original reasons behind intention to leave, creating a negative cycle underpinning the current staffing crisis. There are high-risk groups for leaving that challenge the employment pipeline. Those who are younger in lower bands and with less experience are more at risk. The trust and clinical setting influenced intention to leave, with those working in inpatients were more likely to leave their organisation as soon as they can find a new job. Those in community-based settings were more likely to take a career break or retire. Participating nurses in Trust 1 were more likely to leave their organisation and the nursing profession than those in the other 2 trusts. This means whilst we have a national problem, some trusts are retaining staff better than others. What's next? Trusts need to shift their efforts from recruitment to retention. Each trust needs to appoint a retention lead with power to make change in the organisation. This should be someone who is part of the senior leadership team. Trusts must tailor retention interventions to meet the specific needs of their trust and clinical settings, focusing on the first 3 themes to help prevent disillusionment and staffing pressures occurring, help target retention plans and activity, and continuously review what works and what doesn't. To find out more about the Retention Project to inform your retention strategy, visit the link on the screen.